Hi, I'm Dr. Felice Gersh, your integrative OBGYN physician. Today, we're going to talk about a topic that comes up a lot. Can you use oral contraceptives for treating perimenopause? And if so, what are the pros, what are the cons, and how long can you stay on birth control pills? The reality is that they can be used, but it would not be my first choice. The first thing to understand about the use of birth control pills is to know what are they. So many women I see really aren't sure what birth control pills contain or how they work. In fact, many women are given birth control pills and told these will regulate your periods. I cannot tell you how many times I've heard that. They don't regulate your periods at all. The way that they work is really simple. The mechanism is to shut down ovulation. So in a normal, fertile, reproductive aged woman, she has a menstrual cycle. The first 2 weeks are called the proliferative phase from the uterine lining's perspective. And during that phase, the uterine lining is growing. From the ovaries' point of view, it's called the follicular phase. The follicles containing eggs are growing. Now, mid-cycle, you should have ovulation. There's a giant spike of estradiol, that's the estrogen made by the ovary, followed by a giant spike of luteinizing hormone, which comes from the pituitary gland, which triggers ovulation. After that, you make progesterone, and you continue to make estradiol at a little higher level. Now, this is really important because progesterone has all kinds of feedback mechanisms. So it was discovered that if you give a woman a very substantial dose of a mimic, not real progesterone, although it theoretically could be done with real progesterone, but it would be so much, it would be really hard for a woman to tolerate such a high dose. So artificial or mimics of progesterone called progestins were developed. And it was found that just like in pregnancy, like for example, if a woman becomes pregnant, she stops ovulating. It would be very inconvenient if a woman who is pregnant would keep ovulating. She could get pregnant again. This would be crazy. So what stops a woman who is pregnant from ovulating over and over? It's the high levels of progesterone. So that is the mechanism in pregnancy. So, but we would find it very uncomfortable to give high levels of progesterone because it would be hard to give it because it's not being made. If you give it as a drug, you're not giving it as the way the ovaries or the placenta would give it, which is directly into the blood. So in any case, it would not be easy or convenient to give high doses of bioidentical progesterone. So fake progesterone called progestins were created. These progestins come in a variety of types. Most of them are derived from a compound called 19-nortestosterone. So it's a testosterone precursor. It's converted into progesterone in a laboratory. And there is one type of progestin that's in birth control pills that is a derivative of spironolactone, which is a totally different molecule, and that progestin is called drospirenone. So these different progestins at very high doses in terms of how they would impact the body are given to reproductively aged women, and they work in a manner similar to like high amounts of progesterone in pregnancy. They work in the brain with a feedback system, so you do not get a spike of estradiol, you do not get a spike of LH, luteinizing hormone, and ovulation is suppressed. So the mechanism of every birth control pill that is combined with a form of estrogen, and I'll mention in a minute the progestin-only pills just in passing so you know what they do. The progesterone mimic the progestin that's in birth control pills. That is what shuts down ovulation, and that is what is in a birth control pill to prevent pregnancy. Then they add in usually, not 100%, there are a few birth control pills that have a different form of estrogen, but the majority have a mimic of estradiol, but it's not estradiol, and it doesn't operate in the same way as estradiol on all the estrogen receptors that estradiol operates on, and it operates in a different way, but it's still in the family of manufactured, not human bioidentical estrogens. Technically, it's an endocrine disruptor for estrogen, and technically the progestins in birth control pills are progesterone endocrine disruptors as well. An endocrine disruptor is any chemical, natural, biologically made, or made in a factory that interferes in any fashion with a natural hormone. It could be the production, distribution, utilization, or elimination. So any or all of those would be called, if you did interfere with them, would be called an endocrine disruptor. So the bottom line is the high amount of this progestin is combined with a form of estrogen, typically ethinyl estradiol. The estrogen component, the ethinyl estradiol, is added to birth control pills for the purpose of cycle control, to try to keep bleeding from happening, because you do make a little bit of estradiol, and since the whole system is altered, you could have breakthrough bleeding. So the idea of adding the progestin, not real progesterone, with the fake estrogen called ethinyl estradiol is to mimic a menstrual cycle. It's to give the illusion that you are creating a regular menstrual cycle. But in reality, the ovary is shut down almost completely. There's a little bit of estrogen made from the ovary, but not much, very, very little. And there is no ovulation, and there is no progesterone made at all. So if you are in the perimenopause and you are having night sweats or hot flashes, or you're having irregular cycles, or whether they're too frequent or infrequent, and you go on a birth control pill, it will do the same thing in a woman who is 48 or 54. It will shut down the ovaries so that they will not ovulate. They will make minimal amounts of estrogen and not make any progesterone, because there's no ovulation. So the normal menstrual cycle will not happen. So you're not regulating the menstrual cycle. You're not fixing the menstrual cycle. You are eradicating the menstrual cycle. But there could be some pluses in that if you're having really irregular bleeding because of hormonal imbalances at the time of the perimenopause, because the perimenopause can have a lot of erratic hormone production. You can even make too much estradiol because the brain has sensors to estrogen, and when you make too little, the brain will increase the gonadotropins, luteinizing hormone, LH, and FSH, follicle stimulating hormone, to create more stimulus to the ovaries to make more estrogen. And in the perimenopause, the ovaries can respond. It's like if you really push an animal really hard, it will get up and it will move, but obviously it has to be alive. But once you get into menopause, you can push and prod the ovaries all you want. They're not going to make any more hormones because you don't have any more eggs. They can't do it. But in the perimenopause, if the ovaries are pushed hard enough by the stimulus coming from the pituitary because of the brain putting out its hormones, the little signaling factors that tell the pituitary to make more gonadotropins, then the ovary will respond, and in some cases over-respond and make a ridiculously high amount of estradiol, and sometimes release 2 eggs, which is why having twin babies is more common in women during the perimenopause. They're still fertile, not very fertile, but fertile enough that they could actually release 2 eggs, get actually fertilized, and then have twins. So the bottom line is that for a woman in the perimenopause who's having a roller coaster of hormones being produced, so high, so low, irregular bleeding, prolonged bleeding, sometimes just shutting the ovaries down for a little while can make sense. We can't have women bleeding for weeks straight or having heavy bleeding that they're losing so much blood and they're getting iron deficient. So sometimes that is a way to go, to put a woman on a birth control pill. Sometimes all you need to do is you can use a progestin alone, because your goal is just to clean out the uterine lining, to turn the uterine lining into a unified secretory state, which is what progesterone does. So you could give a substantial amount of a progestin for maybe a few weeks. That's all. And it will convert the uterine lining to a state that will allow it to then shed in a uniform way. So you don't have this irregular bleeding, have the uterine lining in all different levels and all different states. In fact, if you biopsy the uterine lining in a woman in the perimenopause who's having crazy irregular bleeding, you will typically find what's called disordered proliferative endometrium, which means the uterine lining is all different heights, but it's all growing, but it's all different heights. And often it will say with breakdown endometrium. So some of it is just breaking down, it's shedding, it's bleeding. But sometimes it will also say with secretory components, that some of it has been transformed into secretory. So basically, it's the uterine lining is all over the place. It's growing, it's shedding, it's bleeding, it's secretory, it's proliferative. And when a woman gets a uterine lining like that, it is really important to get it under control. And you can do that by giving a birth control pill for a short period of time, maybe 3 months, or you can give a few weeks of just a progestin like norethindrone. And by doing that, you'll get the uterine lining converted to a secretory status, just like a woman would have just prior to having a normal menstrual period. Then you let the uterine lining just empty itself. We call that shed, so you'll have shedding, and then it's like a reboot to the uterine lining. Now, that is obviously a treatment for irregular or heavy bleeding. I didn't mention night sweats or hot flashes, but these are all different components of the perimenopause. Women can have all kinds of symptoms. They can have palpitations. They can have suddenly migraines, because migraines typically are triggered by changes in estradiol, like a drop. And women have sometimes a roller coaster of estradiol. So women can have suddenly exacerbations of migraines or even new onset of migraines. They may have sleep problems, not just night sweats and hot flashes, but just other reasons that they wake up because they have circadian rhythm dysfunction. They can have irritability, mood swings. So there's a whole gamut of issues. They can start having gut problems, heartburn, reflux, and so on. So none of those are completely going to be addressed by chemical hormones in a birth control pill. But the chemical hormones, I'm going to call them that because they're not human bioidentical. So I could call them non-human, I could call them endocrine disruptors. I'm actually open to ideas of what to call the hormones in birth control pills to just distinguish them from the bioidentical hormones that an ovary would be producing or can be given as a prescription drug. You can prescribe bioidentical hormones as well. So birth control pills are really good short-term, or just the progestin, for short-term management of crazy irregular bleeding. Now, some women may say, but I don't want to even face this again. Now, we can't. What can we do? For those problems, we can give just regular bioidentical progesterone. Once we clear out the uterine lining, like a reboot, a fresh start, we can give bioidentical progesterone every month for 2 weeks to have a regular withdrawal bleed, like shedding of the uterine lining, to prevent exactly what we just treated, this crazy, irregular, heavy bleeding. So we can actually use bioidentical hormones once we get the uterine lining controlled. And that's really my preference, because I will always choose what's natural and bioidentical to a chemical, because the bioidentical, the natural human hormone, is superior in its effects throughout the body, which I'll touch on in a moment. So what about night sweats and hot flashes? So we already covered the irregular bleeding. It can and sometimes needs to be controlled with these synthetic, non-human hormones, because you really can't easily give the doses that would be sufficient to make this proper conversion in a reasonable and thorough manner. So giving the progestin or the birth control pills can be really helpful short term to help control this bleeding problem. What about night sweats and hot flashes? Yes, birth control pills and even progestin-only pills can be very helpful in reducing night sweats and hot flashes. So if a woman wants to go on birth control pills for that reason, she can. It's not my preference, but it does treat them. In fact, even the most non-bioidentical hormones seem to be able to treat night sweats and hot flashes, which it's a blessing and a curse depending on how you look at it, because it allows the prescriptive use of hormones that are really not optimal for a woman's health. So why would I say that? Why would I say that birth control pills are not optimal for a woman's health, even though they can help control bleeding? They prevent pregnancies, and that's another story we'll touch on, because certainly that's what they were created for, was as contraceptive, and they can treat night sweats and hot flashes. So I've got to give them the credit that they're due. They can help with that. But what can birth control pills do that I don't really like? They increase the risk of blood clots, because when you take a birth control pill, the estrogen form that's in it, typically, not always the ethinyl estradiol, but other birth control pill estrogens, so not too many, they get converted anyway in the liver. All of these get converted primarily to estrone. That's one form of estrogen, also known as E1, which works predominantly on one estrogen receptor called the alpha receptor. And the alpha receptor is more pro-inflammatory, because that's just what alpha does. Alpha is the receptor on the innate immune cells, the cells that are the first responders of the immune system. So they can produce and release inflammatory cytokines that are designed to kill pathogens and to help dissolve in like damaged tissue. But when you have just estrone, too much estrone, you become more pro-inflammatory. And part of the inflammatory response is pro-clotting. And that's the last thing we want. That's why birth control pills have a warning on them that they can increase blood clots. Now, what else increases the risk of blood clots? Age. So aging is like the biggest factor in blood clots that form. We're talking about deep vein thromboses, like blood clots in the leg, which can break off and travel to the lungs, creating a life-threatening condition called a pulmonary embolism. So we do not want to raise the risk of that. So women in their 40s and 50s have a higher risk because they are older. So I do not like that. Birth control pills would never be given to a woman who has uncontrolled high blood pressure, uncontrolled diabetes. She just recently had a heart attack. Why is that if they're so good for you? Because they're not so good for you, because they're pro-inflammatory. And the last thing, someone who has metabolic dysfunctions like diabetes and heart disease and high blood pressure, and especially when it's recent, uncontrolled, the last thing they need is to take a pill that increases inflammation and metabolic dysfunction. So that is why I'm not in favor of those as a choice if I have an alternative choice, which I do, which is bioidentical hormones, which can be used in the perimenopause and, of course, in the menopause. And as well, when I'm looking at other things like palpitations and insomnia and mood swings, bioidentical hormones, in my experience, are far superior to the use of oral contraceptive type hormones. But what if you need birth control? Well, that's a dilemma I have to face all the time. I never tell a woman she should not use birth control pills if she doesn't have a real serious situation, health condition that would make it really especially dangerous for her to use birth control pills. But if possible, fertility is not gone, but it's low during the perimenopause. I already told you you can get twins, so I would never tell someone to just gamble and hope that they don't become pregnant when they don't want to become pregnant. But if it's possible, I do encourage husbands to have vasectomies. They're really safe. It's a really quick little procedure. And then the poor woman doesn't have to deal with this, right? So if you have a partner, see if he's willing to have a vasectomy. Otherwise, consider using condoms. They're actually very effective, and they're not like your grandfather's condoms. They're very thin. They don't impede sensation. And you can also use other topicals like Phexxi, which is a gel that if you combine it with condoms, it's as effective as birth control pills. That takes effort. I realize that. I also still fit women for diaphragms. I know it's old-fashioned, but when it's used with a spermicide and it's used regularly, especially if you combine it with condoms, they're as effective as using oral contraceptives. So of course, women can have a tubal ligation if they're so inclined, but that's a more involved surgical procedure done with a laparoscope. So I totally understand when a woman says, I really want to go on birth control pills for contraceptive use, but I do try to encourage them to use an alternative method if they're open to it. But these are all really important conversations. Say a woman wants to be on birth control pills for whatever the reason, to control her bleeding. She finds it most convenient. She understands the pros and cons. How long can she stay on them? Well, there's an absolute end time, which is also arbitrary. Everything's kind of arbitrary. And it's age 55, which seems really kind of old, to be on birth control pills. Not too many women at that age are on birth control pills. But if you have no real risk factors other than the fact that you're getting into your 50s or 55, if you have no other real risk factors, like you have incredibly high cholesterol, high blood pressure, you've had heart disease or things of that sort, then you could be on birth control pills all the way up to age 55. Now, how would you know when to come off of them? Well, you can get an FSH level. Sometimes it will still rise in spite of being on birth control pills. The other option is if you do the week off or 4 days off, depending on what pill you're on, at the very tail end of the off days, you can get an FSH, follicle stimulating hormone level, and see where that's at. The other thing you can do is just go off the birth control pills for a month and then do some tests and then see what happens, how you're feeling and what the FSH. Now, getting an FSH level that's high only tells you that your ovaries are declining in their production of estrogen or their ability to make estrogen. It doesn't mean that it's all over. You never know when it's all over unless you're doing nothing but watching and seeing what happens. So an FSH level that's very high, if you go off the birth control pill, is very consistent with you're already in menopause, but we never know when the last egg is gone, if there's any chance you could still have an ovulation, unless we just sit on the sidelines and watch to see what you do. So these are just choices that every woman can make. But I encourage my patients, if they're on birth control pills, to stop them and see how they're doing around age 50. I really don't love women on birth control pills into their 50s. I don't love them at any time, but especially in their 50s. But, there are some women that have late onset menopause. That's over the age of 55. So they're actually still having totally regular periods. Of course, they're perimenopausal, but they are having regular periods all the way up until they're 55. So those women may say, well, I just don't want to take a chance. I want to stay on birth control pills. And I would let them, even though I would try to offer them the bioidentical hormones and another form of contraception. But it's a personal choice. My feeling is every woman should know their options. I'm not here to dictate. I'm here to offer options, the pros and cons. I will always make a recommendation, and then it's your choice. It's really important to understand your choices, the pros and the cons. So perimenopause is such a challenging time to manage, with symptoms that can be significant in some women, minimal in others, can be a lot one month and less the next month. It's very variable. Hormone levels are fluctuating, it's unpredictable, it's exciting, and it can be scary. So having hormonal balance during the perimenopause is a challenge, but by giving bioidentical hormones after you control any irregular bleeding and get the uterine lining cleaned out by giving either birth control pills for maybe 3 months or a progestin for a few weeks, cleaning out, like rebooting the lining and then giving bioidentical hormones is a fantastic option. That does not provide contraception though. Birth control pills are totally available. It's just a question of your priorities. So I want you to understand all of these are options that you should avail yourself of and talk to your own provider. Menopause is challenging. Perimenopause can be even more challenging, but viable solutions are available.